Welcome to everybody online to the York Region Public Health's Workplace webinar series. Our topic today will provide you, the employer, with tips to increase COVID-19 vaccine uptake of your employees. My name is Andrea Main, and I will be moderating the session today. We are joined today by Dr. Leon Genesove, the York Region Public Health physician that is leading the pandemic response for our workplaces. Next slide, please. Please note, this meeting will be recorded. During this meeting, you will have the opportunity to contribute or ask questions. Questions will be gathered and sorted to avoid duplication and to ensure the best response to your question. Although your name will not appear on the screen to attendees, producers and presenters may have access to that information. If you have any questions about the recording of this webinar, please contact HEOC Communications at york.ca. So to ask a question, select the Q&A icon on the right-hand side of your screen. Type your question in the compose box and then select send. I will screen the questions and then pose them to the moderator at the end of the initial part of this session. This session is 30 minutes. The first 10 to 15 minutes will be Dr. Leon Genesove presenting, and the second half will be a Q&A session. So I'd like, without further ado, to introduce Dr. Leon Genesove. He is a public health physician with York Region Public Health, and he joined York Region in April of 2020. He was previously the chief physician at the Ontario Ministry of Labour. He retired from the Ministry of Labour in 2019 after 35 years. Dr. Genesove is a Royal College specialist in occupational medicine, as well as a certified family physician. He's also a recipient of the Queen Elizabeth II Diamond Jubilee Medal and a recipient of the Ontario Volunteer Service Award. So without further ado, I'll hand it over to Dr. Leon Genesove.
Thank you so much, Andrea, and welcome everybody. Thank you for joining us today. Our topics today are supporting vaccine uptake. We'll be discussing building confidence in the workplace, best practices to improve vaccine uptake, and provide you with some resources to support communications in your workplace. First, a little bit of background I want to give on vaccinations in York Region. So vaccines are safe, they're effective, they're the best way to protect you and those around you from serious illnesses. Vaccines are tightly regulated and closely monitored in Canada, and only vaccines that are safe and effective are approved for use in Canada. So how can you build confidence in the workplace for vaccines? So first of all, I'd like to start by thanking, on behalf of York Region Public Health, thanking all the essential employees and employers in our community who continue to practice excellent public health measures and staying safe while at work and keeping employees safe at work. And the purpose of today's webinar is to highlight how employers in York Region can help promote vaccine uptake within their organizations. Before we discuss strategies to improve vaccine uptake, I want to share some of the successes of York Region's vaccination program and declining COVID-19 cases. So a high percentage of York Region residents aged 12 and up have received at least one dose of vaccine, and a significant percentage of the York Region population are now fully vaccinated. And the current statistics on vaccination and COVID-19 are available on the york.ca website. To get full protection, 2 doses of vaccine are strongly recommended, especially to provide protection against the variants of concern. Where COVID-19 deaths have occurred, it has been in those individuals who have not been vaccinated, or they may have received their first dose within 14 days of acquiring the COVID-19 infection. That's why it's very important to get first doses as soon as possible if people haven't, and to go for the second doses at the appropriate time. So we still have a few individuals in York Region who have not gotten their first dose. And York Region has been offering walk-in pop-up clinics dedicated to first doses. So keep an eye on our Twitter feed for more information about that. The number of COVID-19 cases in York Region reported daily continues to decrease steadily week over week. Workplace outbreaks are also continuing to decrease, which is really good news. The number of new and ongoing workplace outbreaks in York Region has dropped significantly after remaining high for several weeks. A highly immunized workforce can positively impact your bottom line by minimizing absences due to illness or exposures to COVID-19, by keeping your staff healthy and safe, and reducing the likelihood of having COVID-19 outbreaks, which could impact and threaten your operations and business continuity. I can just ask you to go back to the slide beforehand. So employers can help increase vaccine uptake among workers. It is important as employers to equip yourself with adequate information to engage employees on basic COVID-19 vaccine information. Employers can play a key role in building trust among employees about COVID-19 vaccines by encouraging workplace vaccine literacy, addressing potential barriers, and preparing employees for vaccination, either at the workplace, in community clinics, our pop-up vaccination clinics, or at pharmacies when it becomes their turn to be vaccinated. So why should employers promote vaccination? So, very important. You want to keep your workforce healthy by preventing your workers, your employees, from getting COVID-19. And by getting vaccinated, employees will also protect their families and their coworkers from COVID-19. So these vaccines are safe and effective against preventing infection and reducing severe outcomes. And as I mentioned, the vaccines provide very high levels of protection against hospitalization from the Delta variant that is now circulating in Ontario. Vaccinations will also reduce absences due to illness. They'll improve your productivity by keeping the workforce in the workplace, and improve morale, and people will feel protected. And again, importantly, vaccines prevent hospitalizations and death. Very important. So our next slide, please. So what strategies do you have to improve vaccine uptake? Well, there's a number of strategies employers can take to improve vaccine uptake among their employees. So one strategy is to employ vaccine champions. So you can have vaccine champions, for example, managers, supervisors, or team leads, or other respected staff in your workplace, and have them share their stories and reasons for choosing to receive the vaccine. And consider sharing through social media or through your company's internal intranet site. You can identify and partner with trusted leaders from different areas and different occupational groups in your workplace to help convey information and facilitate that dialogue, and design targeted strategies for effective communication. You can consider educating staff by hosting small group discussions or having one-on-one conversations with staff. So you want to hold, or you should consider holding culturally and language appropriate discussions with staff to address questions and concerns and get input on how to increase vaccine confidence. You want to bring the discussion to where people are based in your workplace. And you want to build trust by addressing their concerns and discussing reasons for vaccination. As I mentioned, for a vaccinated workplace will help prevent exposure to COVID-19 on the job. It'll help protect workers and their colleagues, and it'll help protect the families of workers at home, especially those that are too young to get immunized. Vaccinations save lives. Vaccinations will help you keep your business open and keep your business serving your customers. You want to provide opportunities for staff to ask and have questions answered about vaccines. So you can consider virtual town halls or emails or other appropriate methods for your workplace. You may want to consider making vaccine uptake visible in your workplace. So create photo galleries and break rooms of vaccinated workers, record and share testimonials, encouraging people to share with colleagues, friends, and family that they've received the vaccine. And create a coverage goal for your company and track your progress to the vaccination goal until it's complete. Again, as we all do nowadays, communicate across multiple channels is very important. So you want to share consistent key messages in multiple formats and across multiple channels, whether it's by videos or blogs, emails, posters, or social media. And tailor the messages to the unique staff characteristics and needs within your organization. So some communication topics can include, where should employees go to get a vaccine? And York Region currently has several mass public vaccination centers and pop-up clinics available. Some additional strategies to improve vaccine uptake include working towards racial equity. So we want to acknowledge existing inequities and systemic racism does exist. We want to acknowledge disparities in COVID-19 health outcomes by race and ethnicity. And we want to make a commitment to advance health equity and work with trusted leaders to create healthy communities for all. So for example, as one example, one might consider partnering with organizations such as the Black Health Alliance or the Black Physicians Associations of Ontario, or other organizations that support the Indigenous population or persons of color. We want to have communications clear on employee rights under the Worker Income Protection Benefit that's shown here on your screen, and the Employment Standards Act in using the 3-day sick days towards obtaining the vaccine. And if your workplace is hosting an immunization clinic, consider having people of color or that speak the same language as those attending to help support the clinic and promote the vaccine. We want to remove barriers to vaccination. So some things to consider in your workplace is to provide paid time and transportation to get staff vaccinated off-site at clinics, and ensure that temporary and agency third-party staff are included in your vaccination strategies by providing them with information on community-based vaccination clinics directly or through their hiring agencies. We want to consider using incentives or disincentives. So providing, for example, providing additional sick leave in case vaccine side effects result in missed time from work. And as I mentioned, employers are now required to provide eligible employees with up to 3 days of paid infectious disease emergency leave because of certain reasons related to COVID-19. And eligible employers can apply to the Workplace Safety and Insurance Board to be reimbursed for some of these payments. Another incentive is a public health incentive, and when staff are fully vaccinated, when people are fully vaccinated, meaning 14 days after they've received the second dose, they do not have to self-isolate if they remain symptomatic, if they do happen to be exposed to a confirmed COVID case at work or in the community. So that's a great benefit. Fully vaccinated people, if they happen to be exposed to a COVID case and they have this vaccinated person has no symptoms, they're feeling fine, they do not have to go into self-isolation for 14 days. That's excellent. Can I have the next slide, please? Thank you. So York Region provides a number of resources to support communications directly through York Region resources on our website. I'll mention some of that. There's COVID-19 vaccine promotion toolkits from the Ontario government, and the Center for Excellent Practice has something called a Protect Plan for COVID-19 vaccine discussion. So I won't go into all the details about all this information that's available to support your communication efforts, but I'll direct you to a number of websites on York Region. For example, york.ca/COVID-19 vaccine info. That's york.ca/COVID-19 vaccine info. Has a lot of information and resources for you, frequently asked questions about the vaccine, the impact of the vaccine, quick facts, and infographics to share. The Ontario government's COVID-19 vaccine promotion toolkit has a number of resources to help you boost vaccine rates in your workplace and to support community vaccine safety with a whole bunch of tools for you in multiple languages. And you're able to get detailed information to provide your employees. Let's go to the next slide, please. So where can employees get vaccinated? So appointments can be booked at any York Region clinic or through another location on the provincial booking system. So to book at a York Region clinic, you can visit the York Region booking page or connect with Access York. You can see the contact information there. And it's also possible to book other locations through the provincial booking system. To book with York Region clinic, you can go to york.ca/COVID-19 vaccine for booking in York Region clinics. As I mentioned, additional information is available about at york.ca COVID-19 vaccine info, that website. And there's a special website for businesses, york.ca/COVID-19 for business. So a lot of resources. Just want to mention that appointments can be booked at any York Region clinic or through another location on the provincial booking system. So there's a lot of possibilities for booking. And to make things seamless as possible, York Region is now offering walk-in basis for first doses only for those who live, work, and go to school in York Region. Please note this is for first doses only. For second doses, please book online, as I've mentioned. So it's very important to do that. Thank you. Let's go to the next slide, please. I'm going to talk a little bit about promoting a workplace safety plan and a vaccination policy in York Region. And then the next slide, please. So as an employer, it's your responsibility under the Occupational Health and Safety Act to take every precaution reasonable in the circumstances to protect the worker. All businesses that are operating must have a written safety plan by law. As a best practice, discuss and share your safety plan with all employees. There are special requirements for long-term care plans, which I won't go into the details of, but each staff member working in a long-term care program must provide proof of vaccination of each dose, or provide a documented medical reason for not being vaccinated, or participate in an educational program about the benefits of vaccination and the risks of not being vaccinated. So those are requirements for long-term care homes in Ontario, and you may want to look at that for yourself. In addition to workplace safety plans, employers may want to consider a workplace vaccination policy. And an effective vaccination policy could include elements that I discussed earlier in the presentation, including outlining how you, as an employer, can build vaccine confidence, promote strategies, and a communications plan to promote vaccine uptake, and provide resources to educate employees about the benefits and safety of vaccination and the risk of not being vaccinated. I just mentioned that employers, as an employer, you should seek legal advice when developing a vaccination policy to ensure adherence to human rights requirements, privacy, and other applicable laws. As an employer, by increasing vaccination confidence in employees, you have the opportunity to boost vaccination rates among your employees, to save lives, to make our workplaces, to make your workplaces safer, to keep the businesses open, to support your customers, and to contribute to reopening York Region faster. Thank you. Next slide, please. So now we can open up to questions and answers, and I'm going to turn this back to our moderator, Andrea.
Great, thank you. So this is the question and answer part of the session. I'll just ask you to mute Dr. Leon. Great. Okay, so I'll start with the first question, and just a reminder to, if you look at the top of your screen, you'll see a little bubble with a question mark in the middle of it. Just hit that bubble and then you can pose your question in the chat, and I will then pose it to Dr. Genizov. So the first question that we have is, we have an employee with asthma who frequently coughs in the office common areas. She has been eligible for the vaccine for more than 2 months now and refuses to get vaccinated for COVID-19. What can we do to protect ourselves or pursue her to get vaccinated?
Thank you. That's a good question. So you're going to find some people that do resist vaccine. Some people do have good medical reasons. There are actually very few absolute medical contradictions to COVID vaccine, and that's the main one is having an anaphylactic allergic reaction to one of the components of the vaccine or the vaccine. So you have to be careful with people with allergies. I think it's important to encourage the person to speak to their personal physician and get health advice for that. And you know, if they're open to it, make it easier for them to get the vaccine by providing them time off or transportation, or somehow making it easier for them to get the vaccine. And it's, you know, even people with background health conditions, if they end up contracting COVID-19, the health outcomes are not as good as, say, a person without background health conditions. So again, you have to encourage them, ask them to speak to their personal health advisor, and whatever you can do to provide them with education and facilitate them going to a vaccine clinic is going to be very helpful. Okay, thank you.
Great, thank you. And our second question is along the same lines. What happens when an employee does not want to get vaccinated? We would like everyone to get vaccinated, but 2 people do not want to. So similar question.
Right. So again, you can't we have to encourage people to be vaccinated. I know it's very difficult in some cases. You have to make it easier for them to get to become vaccinated. As I mentioned, by facilitating attendance at a vaccine clinic, whether it's through time off or transportation, having one of these workers' colleagues sit with them to help explain the benefits of the vaccine and how it's going to protect that individual themselves, their families, the co-workers, and that it will also, as I mentioned, prevent any or reduce the possibility of having to isolate because of being a close contact. So again, you know, a knowledgeable person in the workplace that can be a COVID-19 champion to speak to the person and encourage them. And that's pretty much it.
Great, thank you. Next question. For individuals with mental health issues, example, passing out at the sight of a needle, where can they go to avoid the tension of lineups, etc.?
Right. So it's very important for those individuals to book an appointment for the vaccine, so that they don't have to wait in line. So the mass vaccination clinics in York Region that we have, for example, Maple or Richmond Hill, if you book an appointment there, there's very little waiting time for that. They're allowed to bring a support person. So when you register them with a support person and have a support person attend with them. So the best thing to do is go to a clinic with that books appointments. The waiting time is usually very, very limited. Most people are in and out in 30 minutes with maybe a couple of minutes of waiting in line, and they're allowed to bring a support person. So that'll help quite a bit. And a question about, if I can just mention about vaccine champions. So those are people in your workplace that are educated and knowledgeable about vaccines, are looking at the information on the york.ca website or the Health Canada website, are familiar with the positive aspects of the vaccine and how the York Region is running the vaccine clinics, and having them speak to in a positive sense to workers with vaccine hesitancy, right? It's important not to shame anybody. It's important to really be positive and have a coworker promote vaccine, a knowledgeable coworker.
Great, thank you. Next question. Will I forever be wearing a mask and visor as my work is impossible to keep a 6-foot distance at all times? I do manis and petties.
Right, so we're going to have another session later on the reopening plan in Ontario. I think that one's going to be in July. We're going to talk about the reopening plan and what's required. The important thing to remember is the more people that are vaccinated with first doses, the more people that are vaccinated with second doses, the quicker we're going to go into the reopening plan and reduce some of those protective measures.
Great. So next question, will vaccination or testing be considered as a requirement in a workplace in the near future?
So we're having we'll be having another session on testing and the reporting requirements in the workplace in August to discuss that. So there's antigen testing, COVID-19 antigen testing has been made available in the workplace through Ontario government program. It's also available through pharmacies. So these are voluntary programs, but workplaces can help initiate the testing programs and get testing kits through the Ontario government programs. Have a look on our website for that and encourage that. Again, it's also important to remember that the COVID screening questionnaire has to be performed, and all of the other protective health measures still have to be in place and still need to be in place.
Thank you. Next question. For restaurant businesses, are workers required to be vaccinated before returning to work?
So there isn't a specific requirement in for restaurants. As I mentioned, there's requirements in long-term care homes, but not in restaurants. Again, it's really important to encourage and to promote vaccine in those workplaces and to facilitate people getting the vaccine. But at the moment, it isn't a specific requirement. It's really important, though.
Okay, next question. Do people have to provide medical reasons not to be vaccinated? If they can't provide medical reasons, can we insist that they get it?
So, I mean, those are questions that dealing with provision of medical information and some of the human rights issues. So as you develop your COVID-19 policy, you have to look at some of the issues in your workplace. Is there a collective agreement in the workplace? Are there other issues in the workplace? And what type of health programs do you have? So that's a good question really to ask your legal advisor for advice on.
Thank you. Next question. What is the appropriate response to people who believe the government is putting trackers in the vaccine and running tests on the population? Right,
so that's a very popular myth in social media. So there are no microchips in the vaccine. It's not correct. So again, if you look on our website, york.ca/COVID-19 info, you'll find some fact sheets there that explicitly state there are no microchips in the vaccine.
Thank you. Next question. Why can't the COVID-19 vaccination be made as a mandatory requirement as other vaccines? It will be easier to ensure everyone is healthy.
Right, so I agree. But I mean, the COVID-19 vaccine is extremely important. This is a decision from the Ontario and Canadian governments at the moment. One of the factors is related to the issue of the approvals process and the emergency approvals process. So at this time, it's not a specific vaccine requirement like other vaccines, for example, childhood vaccines in schools.
Thank you. Next question. We have some employees who are not vaccinated and they need to work closely with customers and other employees. How can we manage these employees? Based on human rights laws, we are not allowed to discriminate them and ask them to go on unpaid leave.
Right, so you have to implement all the what we call non-pharmaceutical interventions, public health measures, such as masking in the workplace, barriers in the workplace, disinfection where appropriate, and all those other measures. Those are really important to strictly adhere to.
Okay, thank you. Next question. Can an employee refuse to wear a mask in the workplace post being fully vaccinated?
So there's still a masking requirement in York Region, and people have to follow all the requirements. So all the requirements in York Region in terms of masks and distancing and barriers and cleaning workplaces, they all still apply to everybody, including vaccinated people.
Okay, thank you. I think this brings us to the end of our session. It's now 12:30, and I just wanted to thank you, Dr. Leon, for presenting today, and thank everybody who's joined the call. And I'll hand it over to you.
Thank you, Andrea. Thank you, everybody, for joining us today. Again, there's a lot of information on our york.ca website, and if you go to york.ca/COVID-19 for business and york.ca/COVID-19 vaccine info, there's a lot of great information there that also take you to links on the Ontario government website and the Canadian website. So thank you for joining us.
Have a great day, everybody.
Thank you.